What would you say about the way people walk here? According to some of the statistics I've seen, the Maasai in Africa have the most perfect walk or the most perfect run.
Right.
If we compare it with the people here, would you say, what percentage would you say of people that don't have a proper walk?
I don't know percentage numbers, but I do know that all day we have our socks on and shoes on and a closed-toe shoe, and our feet are deprived of sensory input. When you're walking barefoot on an uneven surface, you have a constant barrage of information to the brain to tell you where to balance. But our feet all day are kind of locked in this cage, and they're not given any information. So it's no wonder why there's people that have balance problems by the time they're 50 and back problems. I would imagine that if we all walked barefoot on uneven surfaces, we wouldn't have back pain, but that's not realistic in this day and age in Manhattan.
What about these orthodontic shoes that people use and so on? Do they help prevent this, or
Which shoes?
The type of special made shoes that the people use
orthotics.
For orthotics.
Yeah, I mean they're great. I mean, we do orthotics in our office. We digitize them. A lot of what I've seen lately are the MBT shoes that are bent on both sides.
Yeah, that's it.
They're all great. It's just about changing the way you walk, putting different input into your nervous system.
Well, the MBT shoe is based actually on the Maasai, isn't it?
Yeah, I believe
the Maasai run.
I believe it is. I have seen most patients come to my office. Sometimes they are wearing those shoes, and it's a good thing. It's just more muscle activity in the feet, more muscle activity in the back. Good stuff.
Now, if a person is born, let's say, with one leg shorter than the other, and most people have a slight difference between the two legs, I assume. Can this also be helped by this?
By what? The spinal?
With the way they walk or whatever, because this eventually will affect the spine.
Absolutely. That's why one of the things that I do is we do a digitized computer assessment of the way they walk, and we also take an x-ray so we can see which femur head is higher than the other, and do a pair of corrective orthotics by putting a lift, whether it's a centimeter or an inch or whatever it is, to address the discrepancy. That would definitely balance out the spine.
Now, we talked about walking. How about sitting? Now, many people are sitting in an office or sitting behind a desk all day long.
Right.
Is there anything special that they should use, or anything that they can do actually to also help prevent the back from deteriorating?
Yes. I always like to make sure that the knees are lower than their pelvis, and their feet are contacting the floor. Once you have that, you have a closed chain. There's less likelihood of being pressure put on the spine when your knees are lower and your feet are actually touching the floor. I also like for that to be a lumbar support, a little curve in the lumbar spine to help reduce pressure and evenly distribute the loads throughout the spine. And a chair that's ergonomically sound, and the way their monitor is set up is very, very important. These are all things that we address in our back school.
Now, we talk about walking, sitting, and so on. What are some of the other things that people can do that can affect their spine?
To help their spine?
Or things that they can do besides accidents, that in the regular day-to-day life that can actually help the spine degenerate.
Oh, to help it degenerate. I mean, anything from sleeping on a poorly designed mattress that's has a hammocking effect in it, to bad habits, picking up your child the wrong way, doing a sport that usually uses one side of your body, like let's say tennis, and not strengthening the other side of your body, answering the phone like this, or walking and talking with the phone cramped in. But I'm so surprised people are walking with the phone cramped like this, and then
especially with the cell phone, they're more cramped now.
And then they come to my office wondering why they have neck pain. So there's a lot of common sense things you could do to avoid having back problems, like not talking with a cell phone cramped behind your ear. Yeah.
You mentioned one that people quite often overlook is sleeping. If they're sleeping in the wrong position and have the wrong mattress and things like that, that can have quite an effect on the spine also.
Absolutely.
So we had walking, sitting, and sleeping. Those are the three main positions that people are in during their life, and all of them can actually affect the spine.
Absolutely.
If it's done in the wrong way. Now, what are some of the things then done? And let's say with sleeping, I mean, how does one determine whether one has the right mattress?
It's the million-dollar question everyone's been trying to solve. I like a firm mattress, and it has to be to patient comfort and tolerance. You want to have your spine in a neutral position. So if you're sleeping on your back, you want your spine nice and flat. If you're sleeping on your side, you want your spine straight. You don't want your head propped up too high or too low. You want to maintain the integrity of the spine. That means all the curves that are normally there, they should be maintained. So if you're sleeping on your back, put a cervical pillow underneath your neck to maintain that curve that you have in your neck. Also, if you're having lower back problems, put a pillow underneath your knees to support your lower back.
Now, we are dealing with a whole series of vertebrae. Now, are there any of these vertebrae related to particular conditions that occur in the body, or does it not matter?
Well, absolutely. I mean, depending on where there's a misalignment. So if there's a misalignment in the lower lumbar spine, this could affect abdominal tonicity, like in my case with the irritable bowel syndrome. It could, if there's a misalignment in the upper cervical spine, it could affect your immune system, it could affect your breathing, it could affect your heartbeat, and so many different things that could be affected by a spinal misalignment, not knowing you even have it. So that's why it's more than just back pain. But that's how people usually come into a chiropractic office, because that's what we're known for, is helping people with back pain.
Now, let's come back to the spinal decompression in a moment and show the before and after with this condition. Now,
okay. This is an MRI, so this is looking at the spine from the side. This structure here is L4, which is a vertebrae. This structure is L5. This white material is a happy and healthy disc. MRIs measure water, so this is a water-filled disc. This is a not-so-happy disc. And this white structure is a spinal cord. So if this disc is putting pressure on the spinal cord, that's causing pain and dysfunction. This is after a series of 20 visits. I like to have my patients go for an MRI usually 2 to 3 months after their last visit, and we do a pre and post and compare. So this patient, the disc actually rehydrated. You can see that there's more white than that structure, and there's definite some pressure off of the spinal cord itself, and there's also an improvement of the curve in the lower back that I was showing. So the most important thing is the rehydration of the disc and the increase in height of the disc. So this will definitely reduce pressure on that spinal cord, removing interference to the nervous system, allowing the patient to return back to their normal activity without pain.
Right.
And more importantly, addressing the cause, not just the symptom.
Right. Now, you're talking about hydration and rehydration. Are we talking here about water or other fluids, like whatever else is in the body, like lymph and things like that?
Well, we're about 60% water. Is that the latest figure? So yeah, water, interstitial fluid, blood, all these fluids are very essential. So hydration is all of them combined.
All of them combined, right. Well, we're coming to the end of our program. I want to thank you very much for being with us today. I want to thank our viewers for being with us again today. See you next time.